COVID-19 infections in Singapore have doubled, with nearly 26,000 cases from May 5th to 11th. This is a 90% increase compared to the previous week. Professor Dr. Sharifa Ezat Puteh from UKM discusses what this surge could mean for neighbouring Malaysia.
It's not impossible for it to actually just go over the border because we are so close. And there's so many Johorians which are working in Singapore that you might just bring the variant or the virus back into Johor. I foresee there's going to be a surge of cases, but it's not going to be very high. One of the reasons is because it is so much underreporting now. We are not aggressively, doing what we did previously, like tracing and contacting contacts, but also reverting the results of the test. And most of the time, I think people would either test it or they don't test it, or they might test it, but they don't actually tell the authority or the health authority that you are positive or things like that. So there might be some sort of increment. I don't think it's going to be very big. I think it's going to be less than 10% or 15%. And most of the cases, I think, still will be, mild and asymptomatic or mild, And hopefully, and this condition is only what we have seen now, meaning that, the variant is not so virulent, it's not so pathogenic. Of course, the high risk would be more at risk. So unless there's going to be changes, which is usually updated by WHO and of course, our National Ministry of Health, if there's no other updates, I still think that it's not going to be, a major wave onto Malaysia. But we still have to be careful,
The KP1 and KP2 strain of the virus, both descendants of the JN1 variant, currently make up more than 2/3 of the cases in Singapore. Dr. Sharifa weighed in on the significance of these variants.
At the moment, they are still considered variants of interest that everybody should be aware of. And the variants keep changing for some reason or the other. And this is something that, the variant tracking must be there. And I think the Ministry of Health is doing a good job on the surveillance, but also tracking. There's going to be other variants coming up. So this is not in particular something which is really, the population should be fearful of.